Hi, my name is Kiera Spooner. I'm an exercise science student here at North Carolina Wesleyan College. Today I'll be discussing the American College of Sports Medicine pre-participation screening algorithm and how to use it. The ACSM pre-participation screening algorithm is used to help exercise professionals identify participants at risk of cardiovascular complications during or after exercise. Before an individual can begin physical activity or exercise program, they need medical clearance. An individual can determine if they need medical clearance by using the ACSM pre-participation screening algorithm. If the algorithm says medical clearance is necessary, the individual must get medical clearance before beginning a exercise program. The algorithm is made up of three components. The first component is classifying individuals who do participate in regular exercise and who do not participate in regular exercise. The second component is identifying the individual that has any known cardiovascular, metabolic, or renal diseases or has signs and symptoms of any of these diseases. The third component is identifying the exercise intensity that is appropriate for the individual to exercise at. Here's what the ACSM pre-participation screening algorithm looks like. I'll be breaking this down as we go through each component. The first component is classifying individuals who do participate in regular exercise and those who don't participate in regular exercise. For an individual to be considered as someone who participates in regular exercise, the individual must perform moderate to vigorous intensity exercise for at least 30 minutes a day, at least 3 or more days per week in the last 3 months. The first component is the part that I have circled here in the picture. The algorithm asks, does the individual participate in regular physical activity? Here the individual will answer yes or no based on the guidelines mentioned in the previous slide about what it means to be considered regularly physically active. The next component of the ACSM pre-participation screening algorithm is finding out if the individual has any known cardiovascular, metabolic, or renal diseases. For example, diseases like coronary artery disease, heart attack, heart failure, diabetes, cancer, and kidney disease, or any symptoms that may be suggestive of cardiac, peripheral vascular, cerebrovascular disease, type 1 or type 2 diabetes mellitus, and renal diseases. Signs and symptoms of cardiovascular, metabolic, and renal diseases are pain and discomfort in the neck, chest, jaw, arms, or other areas, shortness of breath at rest or with mild exertion, dizziness, syncope, which is loss of consciousness caused by decreased blood pressure, orthopnea, which is feeling breathless when lying down, proximal nocturnal dyspnea, which is sudden shortness of breath while sleeping, ankle edema, palpitations or tachycardia, intermittent claudication, which is pain in your leg when your muscle does not get enough blood during exercise, heart murmur, fatigue, and shortness of breath during normal activities. These symptoms may be undiagnosed in some individuals. This section that I have circled refers to the second component of the algorithm. In the first box, it says no CVs, metabolic or renal disease, and no signs and symptoms of suggested CV, metabolic, or renal diseases. The next box says that the person has a known CV, metabolic, or renal disease and is asymptomatic. The third box says any signs or symptoms suggestive of renal, metabolic, or CV disease, regardless of the person's disease status. The fourth box says no CV, metabolic, or renal disease, and no signs and symptoms suggestive of CV and metabolic or renal disease. The fifth box says known CV, metabolic, or renal disease and is asymptomatic, and the last box says any signs or symptoms suggestive of CV, metabolic, or renal disease, regardless of the disease status. Based on how an individual answered the first question and this question will decide whether or not they need medical clearance before beginning an exercise program. There are two methods that can be used to do a pre-participation health screening, the self-guided or the guided method. This is an example of a guided method. The individual will go into an exercise or health professional to do this method. The professional will sit down with the individual and ask them the questions on the list. Based on their response to these questions, they will decide whether or not the individual needs medical clearance before beginning exercise. The self-guided method can be done by using the Physical Activity Readiness Test Questionnaire Plus, also known as the PARQ Plus. The PARQ Plus asks very general questions and is very easy to do. It is a self-screening pre-partition health screening tool that should be used by individuals wanting to begin an exercise program. It recommends that individuals who are undiagnosed get screened for presence or absence of signs and symptoms of suggested diseases. The screening can be done by a qualified exercise or medical professional, or the individual can do it by themselves. Here's the most recent updated version of the PARQ Plus, which is the 2020 PARQ Plus. To do the PARQ Plus, an individual will answer the questions and follow the instructions listed. The PARQ Plus is about 4 pages long. It is very important when doing the PARQ Plus that you follow the instructions and answer the questions honestly. The final component of the ACSM pre-participation screening algorithm is finding out the exercise intensity that the individual wants to exercise at. Identifying the desired exercise intensity is very important. Individuals can exercise at light, moderate, and vigorous intensities. At the bottom of the algorithm, it discusses exercise intensities for each intensity. For individuals wishing to exercise at a low intensity, they should exercise at 30% to 39% of their heart rate reserve or VO2 reserve, or a workload between 2 to 2.9 METs. Or they can exercise at a perceived rate of exertion between 9 and 11. Exercising at a light intensity should cause slight increase in heart rate and breathing. With individuals wanting to exercise at a moderate intensity, they should exercise at 40 to 50% of their heart rate reserve or VO2 reserve between 3 and 5.9 METs and a rate of perceived exertion between 12 and 13. This should cause noticeably increase in heart rate and breathing. And finally, for an individual that wants to exercise at a vigorous intensity, they should exercise at an intensity greater to or equal to 60% of their heart rate reserve or VO2 reserve and a workload greater than 6 METs and an RPE greater than 14. This should cause a significant increase in heart rate and breathing. If you would like more information about exercise intensities, it can be found in the ACSM Guidelines for Exercise Testing and Prescription, the 10th edition, in Chapter 6, in Table 6.1 on page 146. In the last section of the algorithm that I have circled, it gives recommendations at what intensity an individual should exercise at, based on their answers to the previous components and if they need medical clearance. For example, in the algorithm, an individual who does not participate in regular physical activity and does not have any cardiovascular, metabolic, or renal diseases or signs and symptoms of these diseases, the algorithm recommends that this person does not need medical clearance and should do light to moderate intensity exercise. Let's do an example. A 22-year-old recent college graduate is joining a gym. Since becoming an accountant 6 months ago, she no longer walks across campus or plays intramurals and has concerns about her now sedentary lifestyle. Although her BMI is slightly above normal, she reports no significant medical history and no signs and symptoms of any disease, even walking up 3 flights of stairs of her apartment. She would like to begin playing golf. So let's now apply the algorithm. The individual is currently not physically active. She doesn't have any known cardiovascular, metabolic, or renal diseases. Also, she does not have any signs and symptoms of suggestive diseases. According to the algorithm, she does not need medical clearance, and she can begin exercising at a light to moderate intensity. Thank you for watching this video. I hope that this video has been helpful explaining the ACSM's pre-participation screening algorithm.